So we're going to demonstrate how to use the glucometer. We're going to run controls. I have a little square of parafilm that we're going to put the control on. These are where our test strips are. You got a little microchip on them, which is fun. Okay, so we want to run controls first. Because we're not heathens. And let it suck up, and it'll beep at us when it's happy. And it counts down. You give this a number, 150. Beautiful. So we record that on our QC log and run our sample, and it turns off when you take the strip out. All right, so now I'm going to take my lovely assistant, or patient, as we'll call her, and do a QC, not a QC result, a glucose result on her. And this is when I would ask, what's your full name?
Jane.
What's your birthday?
March 22nd of, let's see, 19. We'll do 92.
92, okay. And I would compare that with the requisition slip I have to make sure that it is the correct patient. You always want to ask for the patient's name rather than saying, are you so-and-so, because they might just reflexively say yes. And then you might get a misidentification. So this is fun times. We have our little lancet, has a little cap on it, and this is a little trigger action on it. Our alcohol pad, because we want it clean, some gauze, and a little bandage, so we don't bleed everywhere.
Just make sure to change your gloves.
Yes.
Not you, but I just tell them, make sure that they change their gloves.
Yes, you definitely want to change gloves between patients, because otherwise gross. All right, and you want to do it on a ring finger or a middle finger? I like the ring finger. And you prefer the non-dominant hand. Is this your dominant hand?
This is my dominant hand.
We'll do the other hand. That way it's not as uncomfortable for you later. So we'll clean it. We'll let it dry, because otherwise you get alcohol in a wound, and that is unpleasant. So we'll patiently wait for it to dry. This is Utah, so it doesn't take us long. So we'll twist this off. That's cool. It's got a little cap. Okay. And then just gonna kind of squeeze it a little bit. And you're kind of aiming for slightly off center of the pad of their finger. And you can have them lower their hand down. And this is when we're like, hey Jane, you need to bleed more. And you want to avoid milking it, but you can gently kind of apply pressure. And you want to wipe off that first drop, even though we work so hard for it. And while she's bleeding, I will get another strip. Before I put the strip in, I'm just gonna help it come out a little bit. We want enough sample. We don't want a short sample. You don't want to milk it right near the tip, because then you can get interstitial fluid in the drop. You don't really want that. All right. Here we go. Turn it on. Oh, look, it's happy. Yay. And it will read it.
I had dried cranberries in my oatmeal. Let's see. Bad.
96. Wait. Yes. 96. I'm going to read that upside down with those numbers. And we can have her apply pressure to that. And then we record our results and dispose of the strip in the biohazard. And of course, we assess our patient and go, how you doing?
Great.
You're doing great. Fantastic. Yep. That's what we like to hear. We want to make sure it's not bleeding anymore. Or not gushing blood. If people are taking blood thinners, they can have problems with stopping. She gets a fun tattoo.
Ooh, it's Hot Wheels.
Yes, winning. Ah, I remember this kind. Or you could just have a regular Band-Aid, but
Hot Wheels, much better.
Much better. There we go. And that's how you do the glucometer.